CEN Written Exams California. Question 1. A patient presents with sudden, severe, and sharp pain in the right lower quadrant, nausea, and vomiting. Rebound tenderness is present. The CEN should suspect. Option A, pancreatitis. Option B, appendicitis. Option C, diverticulitis. Option D, ovarian cyst. The correct answer is option B. Appendicitis. Appendicitis typically presents with periumbilical pain that migrates to the right lower quadrant, McBurney's point, anorexia, nausea, vomiting, and fever. Rebound tenderness and guarding suggest peritoneal irritation. CT scan with contrast is the diagnostic test of choice. Surgical consultation is needed promptly to prevent perforation. Question 2. A patient with capacity refuses life-saving treatment and wants to leave against medical advice, AMA. The CEN should. Option A, allow the patient to leave after documentation and ensuring the patient understands the risks. Option B, restrain the patient and start treatment. Option C, call the family to persuade the patient. Option D, call security. The correct answer is option A. Allow the patient to leave after documentation and ensuring the patient understands the risks. Patients with decision-making capacity have the right to refuse treatment and leave AMA. The CEN should document that the patient was informed of the risks of leaving, and the benefits of treatment, and that they understand. The patient should sign an AMA form. Restraint and treatment without consent are only permissible if the patient is a danger to self or others, e.g., suicidal, psychotic. Question 3. A patient with mania is disruptive and not responding to verbal redirection. The patient is placed in 4-point restraints. The CEN should monitor the patient every. Option A, 30 minutes for circulation, nutrition, elimination, and mental status. Option B, 60 minutes. Option C, 15 minutes. Option D, as needed. The correct answer is option C. 15 minutes. Restrained patients require frequent monitoring to ensure safety. In ED settings, restrained patients should be monitored every 15 minutes for circulation, respirations, nutrition, elimination, and mental status. Restraints should be used only for patient or staff safety when less restrictive measures have failed. Restraint orders require a physician's order and are time-limited. Question 4. A patient with hypothermia, core temperature 30 degrees Celsius, is unresponsive. The CEN should. Option A, rewarm the patient with active external rewarming, e.g., warm blankets. Option B, rewarm with active internal rewarming, e.g., warm 4 fluids, warm humidified oxygen. Option C, administer 4 antibiotics. Option D, defibrillate for VF. The correct answer is option B. Rewarm with active internal rewarming, e.g., warm 4 fluids, warm humidified oxygen. Hypothermic patients with temperatures below 32 degrees Celsius are at risk for cardiac arrest. Active internal rewarming is the priority. External rewarming can cause afterdrop or rewarming shock, peripheral vasodilation causing hypotension. Defibrillation may be attempted for VF, but if the patient is severely hypothermic, the heart may not respond until rewarming is initiated. Management is supportive. Question 5. A patient presents with a sudden onset of sharp, pleuritic chest pain and shortness of breath, but no trauma. Lung sounds are decreased on the left side. What diagnosis should the CEN suspect? Option A, spontaneous pneumothorax. Option B, pulmonary embolism. Option C, pericarditis. Option D, pleurisy. The correct answer is option A. Spontaneous pneumothorax. Spontaneous pneumothorax occurs without trauma, often in young, tall males or patients with underlying lung disease, COPD, asthma. It presents with sudden, sharp pleuritic chest pain and dyspnea, with decreased or absent breath sounds on the affected side. Management includes observation, supplemental oxygen, or chest tube placement depending on size and symptoms. Question 6. A patient presents with a snakebite on the hand. Which intervention is appropriate? Option A. Apply a tourniquet. Option B. Suction the wound. Option C. Apply a splint and elevate the extremity. Option D. Administer antivenom. The correct answer is option D. Administer antivenom. Antivenom is the definitive treatment for snake envenomation. A tourniquet and suction are not recommended, they can cause tissue damage. Splinting and elevation are supportive but are not the primary treatment. Antivenom must be given as soon as possible, with monitoring for anaphylaxis. Question 7. A patient has a smoke inhalation injury. Which finding should raise concern for carbon monoxide poisoning? Option A. Cherry red skin color. Option B. Headache, confusion, nausea. Option C. SpO2 95% with significant distress. Option D. All of the above. The correct answer is option D. All of the above. Carbon monoxide, CO, poisoning causes headache, confusion, nausea, and, later, cherry red skin color. Pulse oximetry, SpO2, may be falsely normal because it cannot distinguish between oxyhemoglobin and carboxyhemoglobin. Treatment includes 100% oxygen, non-rebreather mask, and possibly hyperbaric oxygen therapy for severe cases. CO levels should be measured by CO oximetry. Question 8. Which imaging study is preferred for stroke evaluation within the first 24 hours? Option A. CT angiography, CTA. Option B. MRI with diffusion-weighted imaging, DWI. Option C. CT perfusion, CTP. Option D. All of the above depending on the clinical scenario. The correct answer is option D. All of the above depending on the clinical scenario. Stroke evaluation may include non-contrast CT to rule out hemorrhage, CTA to assess large vessel occlusion, CT perfusion to assess penumbra, and MRI DWI for early infarction detection. The choice depends on the clinical scenario, time since last known well, and availability. For thrombectomy candidates, CTA is essential to assess vessel patency. Question 9. Which triage system is used in mass casualty incidents? Option A. START, simple triage and rapid treatment. Option B. SALT, sort, assess, life-saving interventions, treatment/transport. Option C. Manchester triage system. Option D. Both A and B. The correct answer is option D. Both A and B. START, simple triage and rapid treatment, and SALT, sort, assess, life-saving interventions, treatment/transport, are the triage systems used in mass casualty incidents. START categorizes patients into 4 categories: red, immediate, yellow, delayed, green, minor, black, deceased/expectant, based on respirations, pulse, and mental status. SALT is a more comprehensive version. Question 10. A patient with a dislocated shoulder should be assessed for which complication? Option A. Vascular injury. Option B. Nerve injury, axillary nerve. Option C. Fracture. Option D. All of the above. The correct answer is option D. All of the above. A dislocated shoulder requires a neurovascular assessment before reduction to identify any injury to the axillary nerve or axillary artery. Fractures, Hill-Sachs lesion, Bankart fracture, may also be present. Documenting the neurovascular status is essential before and after reduction. The patient should have an X-ray before and after reduction. Question 11. A patient with pulmonary embolism has a Wells score of 6. What is the most appropriate diagnostic test? Option A. D-dimer. Option B. CT pulmonary angiography, CTA. Option C. V/Q scan. Option D, chest X-ray. The correct answer is option B, CT, pulmonary angiography, CTA. In patients with a high pre-test probability for PE, Wells score 4, CTA is the diagnostic test of choice due to its high sensitivity and specificity. D-dimer is useful in low probability patients to rule out PE but has low specificity. V/Q scan may be used if CTA is contraindicated, e.g., renal failure. Chest X-ray may show other causes but is not diagnostic for PE. Question 12. A patient who is depressed and suicidal is admitted to the ED. The CEN should: Option A, ask the patient if they have a plan to harm themselves. Option B, avoid asking about suicide to prevent giving the patient ideas. Option C, ask the patient only about feelings of hopelessness. Option D, ask the patient about their mood. The correct answer is option A. Ask the patient if they have a plan to harm themselves. Asking about suicidal ideation and a specific plan is essential for risk assessment. It does not give the patient ideas but helps the healthcare team determine the level of risk and implement appropriate safety measures. Direct, non-judgmental questioning is recommended. Evaluation of intent, plan, and means is critical in assessing suicide risk. Question 13. A patient with a psychiatric emergency is being discharged. The CEN should: Option A, provide a written crisis plan and resources. Option B, schedule a follow-up appointment. Option C, ensure the patient has a safe discharge plan. Option D, all of the above. The correct answer is option D, all of the above. Psychiatric discharge planning is an essential part of emergency nursing care. It includes providing a written crisis plan, referral to community resources, scheduling follow-up appointments, and ensuring a safe home environment. This is part of the professional issues domain, covering discharge planning, patient safety, and continuity of care. Question 14. A patient with septic shock has been fluid resuscitated with 30 ml/kg of crystalloid but remains hypotensive with a MAP of 55 mmHg. The CEN should anticipate: Option A, additional fluid bolus. Option B, initiation of vasopressors, norepinephrine. Option C, broad-spectrum antibiotics. Option D, central line placement. The correct answer is option B, initiation of vasopressors, norepinephrine. In septic shock, if the patient remains hypotensive, MAP 65 mmHg, after adequate fluid resuscitation, 30 ml/kg, vasopressors, norepinephrine, are indicated. Norepinephrine is the first-line vasopressor for septic shock. Broad-spectrum antibiotics should be given within 1 hour of sepsis recognition, and a central line may be needed for vasopressor administration. Question 15. A patient with asthma exacerbation is on continuous albuterol and ipratropium nebulizers, systemic steroids, and magnesium sulfate. Despite treatment, the patient's SpO2 drops to 85%, and the patient is becoming lethargic. The CEN should anticipate: Option A, BiPAP. Option B, intubation and mechanical ventilation. Option C, heliox therapy. Option D, chest tube insertion. The correct answer is option B, intubation and mechanical ventilation. This patient is in impending respiratory failure due to severe asthma, lethargy, hypoxia despite maximal therapy. Intubation is required. BiPAP may be tried but is often ineffective in severe asthma with obstruction. Heliox is a rescue therapy but not first line. Chest tube is not indicated. Question 16. A patient with acute aortic dissection presents with a tearing chest pain radiating to the back. Which finding is most suggestive of this diagnosis? Option A, widened mediastinum on chest X-ray. Option B, blood pressure 180/110 mmHg. Option C, pulse deficit between arms. Option D, all of the above. The correct answer is option D, all of the above. Aortic dissection presents with tearing chest pain radiating to the back. Classic findings include a widened mediastinum on CXR, hypertension or hypotension if tamponade/rupture, and a pulse differential between arms, or blood pressure differential 20 mmHg. Key management includes blood pressure control, target systolic 100 to 120 mmHg, with beta blockers and emergent surgical consultation. Question 17. A patient who is 8 weeks pregnant presents with vaginal bleeding and unilateral pelvic pain. Which diagnosis should the CEN suspect? Option A, miscarriage. Option B, ectopic pregnancy. Option C, placenta previa. Option D, normal pregnancy. The correct answer is option B. Ectopic pregnancy. Ectopic pregnancy should be suspected in any woman of childbearing age with abdominal/pelvic pain and vaginal bleeding, especially with risk factors, history of PID, tubal surgery, or IUD use. Unilateral pelvic pain, hypotension, and shock can occur with a ruptured ectopic pregnancy. Quantitative HCG and transvaginal ultrasound are diagnostic. Ruptured ectopic pregnancy is a surgical emergency. Question 18. A patient with a nasal fracture presents with epistaxis. The CEN should: Option A. Have the patient pinch the nose and lean forward. Option B. Have the patient lean back to prevent bleeding. Option C. Insert a nasal packing. Option D. Apply a cold compress. The correct answer is option A. Have the patient pinch the nose and lean forward. The first step for anterior epistaxis, nosebleed, is to have the patient pinch the nose, applying direct pressure, and lean forward to prevent blood from flowing down the throat and causing aspiration or nausea. If this fails, nasal packing, anterior or posterior, may be needed. Cold compress may be used as an adjunct. Posterior epistaxis is a more serious presentation that may require ENT consultation. Question 19. A patient presents with acute pelvic pain, fever, and cervical motion tenderness. Which diagnosis is most likely? Option A, ovarian cyst. Option B, pelvic inflammatory disease, PID. Option C, endometriosis. Option D, ovarian torsion. The correct answer is option B. Pelvic inflammatory disease, PID. PID is an infection of the female reproductive organs, usually caused by sexually transmitted infections, chlamydia, gonorrhea. It presents with pelvic pain, cervical motion tenderness, chandelier sign, fever, and abnormal vaginal discharge. Treatment involves antibiotics, broad spectrum. PID can lead to infertility, ectopic pregnancy, and chronic pelvic pain if untreated. Question 20. A patient presents with sudden onset of severe, sharp, lower abdominal pain radiating to the flank, nausea, and hematuria. Which diagnosis is most likely? Option A, appendicitis. Option B, renal calculi. Option C, ovarian torsion. Option D, diverticulitis. The correct answer is option B. Renal calculi. Renal calculi, kidney stones, present with sudden, severe flank pain, renal colic, radiating to the groin, nausea, vomiting, and hematuria. CT scan without contrast is the diagnostic test of choice. Pain control, 4 opioids or NSAIDs, and fluids are the mainstays of treatment. Ovarian torsion presents with adnexal pain and should be considered in female patients. Question 21. A patient with a psychiatric emergency is placed on a legal hold, e.g., 5150. The CEN should: Option A, allow the patient to leave if they are calm. Option B, inform the patient they are on a legal hold and document. Option C, call the police to discharge the patient. Option D, ignore the legal hold. The correct answer is option B. Inform the patient they are on a legal hold and document. Patients on a legal hold, involuntary psychiatric hold, are not allowed to leave until they are evaluated. The CEN should inform the patient of the hold and document the process. The patient must be kept safe and in a monitored environment. The hold is a legal order, and leaving would be against the law. The CEN should not discharge the patient. Question 22. Which finding is classic for cardiac tamponade? Option A, widened pulse pressure. Option B, Beck's triad, hypotension, muffled heart sounds, JVD. Option C, Kussmaul's sign. Option D, pericardial friction rub. The correct answer is option B. Beck's triad, hypotension, muffled heart sounds, JVD. Beck's triad is the classic presentation of cardiac tamponade, hypotension, from decreased cardiac output, muffled heart sounds, fluid in pericardial sac, and jugular venous distension, impaired right heart filling. Other findings include pulsus paradoxus and electrical alternans on ECG. Emergent treatment is pericardiocentesis. Pericardial friction rub suggests pericarditis. Question 23. A patient is 32 weeks pregnant and presents with vaginal bleeding, abdominal pain, and contractions. The CEN should suspect. Option A, placenta previa. Option B, abruptio placentae. Option C, ectopic pregnancy. Option D, normal labor. The correct answer is option B. Abruptio placentae. Abruptio placentae, placental abruption, is the premature separation of the placenta from the uterine wall. It presents with vaginal bleeding, abdominal pain, uterine contractions, and fetal distress. Placenta previa is painless bleeding, ectopic pregnancy is early gestation, normal labor is at term. Abruption is an obstetrical emergency requiring immediate delivery. Management includes 4 fluids, blood products, and urgent delivery. Question 24. A patient with a suspected stroke is being evaluated. The CEN should. Option A, perform a focused assessment, FAST, face, arms, speech, time. Option B, obtain a CT head. Option C, check the blood glucose. Option D, all of the above. The correct answer is option D, all of the above. Stroke assessment includes a focused FAST, face, arms, speech, time, examination, CT head to rule out hemorrhage, and blood glucose check to rule out hypoglycemia, which can mimic stroke. This is part of the emergency stroke protocol. A CT head is essential before TPA administration. Question 25. A patient with a dog bite wound presents with redness, swelling, and purulent drainage. The CEN should. Option A, irrigate the wound and prescribe antibiotics. Option B, culture the wound and start empirical antibiotics. Option C, close the wound primarily. Option D, apply a pressure dressing. The correct answer is option B. Culture the wound and start empirical antibiotics. Infected wounds, cellulitis, abscess, require cultures and antibiotics. Dog bites can be infected with Pasteurella, Capnocytophaga, and other organisms. Empirical antibiotics, amoxicillin clavulinate, are often started. The wound should be opened, drained, irrigated, and debrided. Primary closure is generally not recommended for infected wounds, they are left open for drainage.